Once baby is head down in the birth canal, can they turn back? Today we're going to talk about if they can turn back, why you care, and what it means going forward. Oh, and also how do we know? Because you want to learn from somebody who has a lot of experience figuring out where babies are in the birth canal. Hello, I'm Hilary. I'm the pregnancy nurse and the owner of a crocheted pelvis. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm here to get you prepared, not scared, for your upcoming hospital birth. So you've had an ultrasound and baby looked like they were head down. First off, big thumbs up. Why do we care? Most often in the United States, they'll only deliver vaginally a baby that is head down. We're going to talk more about that later, but you do want to see the baby is head down if you're hoping for a vaginal delivery, which most people are. However, does that mean that they can change? The sad answer, yes. Your baby, as like your child, can make up their mind at any point in time to go bum down, transverse, however the heck they want. They can make up their mind to move if they want. I hate the uncertainty. And of course, at this point, I'm going to say, if you like information like that, go ahead and give me a follow. If you love the uncertainty of pregnancy, go ahead and give me a follow. But I'm here to tell you the truth and also some good information that might make you a little less worried when we're having this conversation. So do give me a follow and a like because, okay, so early in pregnancy, this baby is all over the place, right? 1 minute they're head down, 1 minute they're bum down. They're just swimming all over the place, right? Early in pregnancy, you feel a lot of movement, like all over the place. And that's totally normal because the baby has a lot of room inside the uterus to kind of do whatever they want. But as the baby gets into your third trimester, it starts to get more cramped, which usually means by about the beginning of your third trimester to 34 weeks, if we notice baby is head down, most likely they're going to stay that way because they just don't have a whole lot of room to change positions, which is the good news. That doesn't happen very frequently. Okay, so how do we know if baby is head down? Well, the gold standard is an ultrasound. It's very easy to tell on an ultrasound because the baby's skull just looks like a big circle. So when we put it down low, if we see that big circle, we know that baby is head down. Also, when we do a vaginal exam, we can tell that baby's engaged into pelvis. We can tell when it's a head. As an experienced labor and delivery nurse, I very much know if I'm not feeling a head, if I'm feeling a bum instead. Also, as experienced practitioners, we can tell that your belly just looks a little bit different if baby is breech. As you can imagine, a head up in your ribs looks very different than just feet or appendages up in your ribs. And so we notice that something's different. Also, when we go to check the baby's heart rate, as you can imagine, since the heart's up here, instead of engaged down in the pelvis, we'll usually find the heart rate a little bit higher. These are all the things that are making us think, I wonder if baby's breech, might want to get out an ultrasound. Also, we do something called Leopold's maneuvers, where we feel on your belly to see where baby's parts are. And then a lot of times you'll feel your provider, especially in your third trimester, kind of really feel right here by your pelvis to see if baby is engaged and if that's a head there. So an experienced provider can do Leopold's maneuvers on the outside and really tell where baby is. But we always confirm it with an ultrasound if we have any question at all. So why does it matter? Well, in the United States, we only do vaginal cephalic deliveries. Most often we do not do breech deliveries. Now you will find a few providers out there who do breech deliveries. And I'm hoping that with time, we will have more providers who do breech deliveries because I believe everyone gets to make up their own choice. There is an increased risk with a breech delivery if done vaginally versus a C-section. That's what they found. That's why all of these practitioners only do that as a C-section instead of a vaginal delivery. However, I think we should be able to make up our own minds as to if this is something we can do or not. But it's a good chance that your provider is not very good at doing a breech vaginal delivery. And you do not want a provider who is not very good at what they're doing this. So I have seen vaginal breech deliveries where the person has come in and the bum is literally hanging out and the provider does a breech delivery. So some of them have some experience with it, but you don't want a provider. You don't want them doing it their first time on your baby. So hopefully with time we'll get better, but that's something to think about if your baby is breech and you're wishing that your provider could do a breech delivery. I'm hoping it gets better, but ultimately right now for most of the providers I see who have not done very much, I would probably do a C-section. Now, if you're thinking, Hilary, this is really confusing. Why all this information? I am here to tell you that the uncertainty of if your baby could flip or making decisions in labor is not going to leave you after this discussion here. This is why I recommend everybody get a high quality birth class that includes information on baby's positioning and also C-sections, because there is a chance of a C-section for everyone that's pregnant. I recommend the online prenatal class for couples. I will put the link below, but I want you to know that it's affordable, it's available 24/7 on demand, and it is created to make your partner not just a cheerleader, but a teammate. And I think you guys will really enjoy it. Okay, what other positions are there? Because I'm sure, as you can imagine, it's not just head down or bum down, also called breech. If it's head down, it's called cephalic. There is also a position called transverse, so where the baby is just kind of off to the side. Now, if your baby is breech and you're thinking, will it turn? Oftentimes they do. Mother Nature knows that babies are best born head down. That is the easiest way. That is why our practitioners tend to only do cephalic breech deliveries. And so gravity, because the baby's head is the heaviest part of them, really drags that baby down. And that's why most babies are cephalic. Plus, it's just easier to deliver a head which molds and shapes to the birth canal versus a bum which is not created to mold and shape to the birth canal. But there are things that they can do. The biggest one that your provider can do is called a version, where they take their lubed up hands and forearms and they try and push baby into the right position instead of off to the side. If your baby is transverse, you have a really good chance of an external version working, depending on your provider. I have seen some providers where I'm like, when are you going to start? And they're like, oh no, I finished, it didn't work. And I'm like, that was quite a job you did in there. So ask your provider if they're good at them, or if someone in their group is good at them, or if they have a friend who's good at them, if they could bring them in to help do the version. That's just my pro tip for versions. So if your baby is bum down, there is a chance they could turn. If your baby is head down, there is a chance that they could turn. As you progress further into your pregnancy, it's less likely that baby could turn, but I have seen, even during labor, a baby switch from head down to bum down. And that is just how children are. I wish it wasn't that way, but it totally is. As a mom of 3, I can testify to that. Now, I really want you to be great at making choices when you are in labor, because a lot of this is like things in the future, right? But you got to make the choice for you on the day when things matter. I have a whole video on that. I'll put the link right up here. I hope this video helped you understand that most often babies stay the same as they are, but there's always a chance that they turn, and that's why you got to get prepared for your upcoming birth. I'm so glad that you're here with me at the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth. And I think there's a lot more videos that you'll like around here too.